I'm really pleased that today we have again another adoption, the 40th adoption, 173 million Jamaican dollars already collected under this program over the 3-year period. This time it's the Kenneth Baugh Health Centre here in Point Hill, St. Catherine, West Central, adopted by the Consul General and his team out of Miami, Consul General Mayor, and the 5K event that they do every year where they raise funds. This is their 5th actual adoption, so this is a real positive thing. As I said here, the adoption process is really about building primary health care and building a community spirit towards primary health care. What it does, it provides a set of resources over 3 years, and the staff and the administrators here benefit from that to do minor additions to solving minor issues. But more importantly, it creates a relationship between the adopter, in this case the diaspora, and our local communities. And many diaspora members want to be involved in this way. So very pleased about this. We have more to do, but today is a good day. This is our 40th adoption, and it is meaningful in that we have supported our health centers by $173 million over the last year or so.
So the rest that adopt, how things been going on for them?
Been going very well. What I find is happening with the adoption is that the adopters visit the facilities with a lot of pride. They come, they tour, they interact with the staff, they listen to some of the immediate needs, and beyond what they commit, which is in this case is $1 million per year for 3 years, they commit other things, so it grows. For example, a while ago when we toured the single female doctor, I remember her last name, who came with High Commissioner Mayor, went inside and I was told that they needed a washing machine. She's writing a check now for the washing machine. You should go and talk to her. Oops. And so that is outside of what was already committed. So that's an indication that once you are connected and you have a sense of obligation, you feel compelled to do beyond what is required. And that's the beauty and the benefit and the power of the adoption process.
My name is Sandra Gibson. I'm from Miami, Florida, part of the High Five with Consul General Oliver Mayer. So honored to be here today for the dedication of Kenneth Baugh Health Centre. Truly it's an honor to give back to the community, and my pledge today is to donate a washing machine that is well needed here at the clinic. So I ask my fellow Jamaicans and my fellow diasporan, please dig deep and assist where it's needed more than anywhere else but here in Point Hill. And also remember, your health is your wealth. The High Five is we focus on our health and our well-being. During the week we have challenges where we drink our water, how many glasses of water you should drink per day. So typically we drink 6 to 7 glasses of water per day, or about 2 to 3 liters sometimes. And on the weekends, on Saturday mornings, we go to the park and we work out. We do exercise, and also we prepare ourselves each year for the High Five Run and Walk, which is our annual event where we give back to adopting the clinics in Jamaica.
How large is that group?
That last year we had 1,000 attendees throughout the southern United States of America.
Participating in the run?
Participating in the run and the walk.
But
even my mother.
How large is the group itself, I-5 group?
The I-5 group?
Yes.
The High Five group is, we have at least 500 members here in the southern United States that are on the High Five, that's actively working out with the High Five group. During the time when we're getting ready for the races, we have volunteers, other organizations that collaborate with the High Five under the patronage of our Consul General, Oliver Mayer.
So now that you have adopted this clinic, what should we expect in terms of the things that you will send to them that are needed?
Well, she's making a list. The mistress is making a list of what is needed in the clinic. She asks for, I haven't seen the list personally yet, but what we will do, we'll go back and make sure we disperse that list, and each of us can take on something that we can donate for. I know my daughter, being a professor at Yale University, they're thinking about collaborating with Yale University, University of Miami, to assist. So that mobile unit is well needed, and the minister mentioned 80,000 in US will cover for that mobile unit, which is not a high goal to meet if we all come together in the diaspora, and not only diaspora, but coming together as our people, coming together to help the underserved. So that's what we do in our community, and I'm looking forward to working with the Consul General and getting this job done that needs to be done. That's so well needed for our community here.
So today, the diaspora has adopted this clinic that you're in charge of.
Yes,
And I know that you have highlighted some needs.
definitely.
Right. Can you speak to the needs? And
The first and first and foremost is the fencing, because we are plagued with animals, persons coming with their goats and cows. So definitely that would be our first priority. We definitely would need a washing machine, even with the times of change. We still here at Point Hill have to be using our hands to wash linens and stuff like that. So we definitely would need that. We also need a generator. From time to time we have rain, and as a result we'll have electricity going, so we'll definitely need to get that generator so as to ensure that our vaccines the cold chain is maintained. And we need autoclave. We have a small one, but it's we need that for sterilization, for things that are needed for dressing and stuff like that. Yes, those are some of the things that we definitely need first.
did you get any firm assurance from the Consul General that they will be providing some of these things that you?
Yes, definitely. I was informed that coming very soon we'll be getting our washing machine, and we are looking forward to that. And of course the fencing will take a little while, but he did agree to see to that as well.
What about the other machines? Sorry.
The autoclave as well, yes.
2 machines.
Yes.
What is autoclave?
Autoclave is a machine that we use to sterilize equipment. So like our speculums, gauze for dressing, stuff like that.
So generally, what's your takeaway from today's adoption?
I'm very pleased. I'm happy. Of course, with our financial constraint, even though we have a nice facility here, we still lack some, things that we need to use to benefit our clients here within this the environment. So definitely, I'm happy, and I'm looking forward to this relationship.
What prompted you to adopt this particular health facility?
We try to get as much feedback from members of our committee back home, as well as the Ministry of Health in terms of their recommendations, and try and spread it across different geographical regions. So this was a recommendation from Ministry of Health. The first one we did in Port Antonio came from Mr. Tony Gray, who is from Atlanta, was born in Port Antonio, and so felt personally connected with that area. So we like to have an inclusive way in how we decide on clinics. So clearly, the ministry, they have identified over 100 clinics to be adopted. We are now at our 5. We will have 2 more sessions like this, adoption, official ceremonies. But one of the things we want to do is not just adopt the clinic, but get involved in the community, find out some of the needs, additional needs for the clinic, and help to provide it with members of the community back home, and how we can support the region, the specific community in a bigger way. So we want to really engage them and get to know the persons on the ground.
Speak to the financial commitment that you have made to this facility.
So the Adopt a Clinic program calls for $1 million per year for 3 years. So all the funds that we do from our 5K, which is in conjunction with the Jamaica United Relief Association, which is a 501c institution in the United States, go towards this particular program. So next year we will have another run. Will be our 4th stage another run. It's going to be in May as a 5th month of the year, and so we'll continue to meet our obligations for each of the clinics that we have. And we have additional donors that are coming on board and sponsors. And the race is building. As you heard last time, we had over 1,000 persons participating. So we're looking for the race to get bigger and bigger, so the impact that we can make will grow as well.